Are you going to have PRK or LASIK eye surgery? It's a very effective treatment and the treatment of choice if you have thin corneas or a very active lifestyle where there's a potential risk of eye trauma. After PRK and LASIK, it's usually pretty painful for several days, but following my advice will help ease the stress of recovery. This is what you need to do to prepare. Hi, my name is Dave Allenby and I've been an eye surgeon for 35 years and performed around 30,000 laser eye surgery procedures here in London. PRK is a common treatment and it's sometimes also called LASEK, which is essentially the same procedure. Consider them identical. PRK was first performed over 35 years ago and I find it highly effective for most common prescriptions. But there are steps you should take before treatment, and after doing thousands of PRK and LASIK surgeries, here are my 15 top tips for preparing for your procedure. If you wear contact lenses, you will need to stop them prior to the surgery. Now it's 1 week for regular soft lenses, including daily disposables. It's 2 weeks for toric soft lenses that also correct astigmatism. And it's 4 weeks for rigid gas permeable lenses, actually 4 weeks per decade of use. Now, due to the longer healing time needed for PRK, I would allow 1 week off work or study. It can be quite sore, particularly in the first 2 or 3 days, and often 5 or 7 days before you're seeing better. Now, trust me on this one and take a week off. Make sure you are not dehydrated leading up to treatment, as it can make dry eyes worse. Next, prepare your home for recovery, as you may not be going out for a while, so I would stock up on groceries beforehand and have a comfortable area to rest. Next, consider audiobooks while your vision recovers, for example from Audible. That will be much easier than trying to read or watch TV. Now, if you're having treatment for dry eyes, I would follow your doctor's instructions as to when to stop your treatment before your actual surgery. Some drops will need to be discontinued sometime before your operation. Avoid alcohol for 24 hours before and 72 hours after surgery. It will dehydrate you and could slow healing. It is an anesthetic, but as Obi-Wan might say, this is not the anesthetic you're looking for. Try to get a good night's sleep before surgery. I know some patients feel anxiety and don't sleep well, but be reassured that PRK or LASIK is the easiest laser surgery to have and where you feel the least. Next, wear comfortable lint-free clothing on the day of surgery. Also, bring sunglasses with you because your eyes will be light sensitive afterwards and for a few days. You'll be glad you brought them. Next, don't use makeup, lotions or fragrances on the treatment day, and I would thoroughly remove any eye makeup before coming into the clinic. Actually, the scent from perfume and aftershave can interfere with the energy in the laser beam and it could affect your results. So also, don't wear clothes that may carry the smell from previous applications of scented products, especially if you like to wear a lot. Next, I would limit caffeine on the day of surgery, but if you're a regular caffeine drinker, do have your first morning drink to avoid getting a caffeine withdrawal headache. Make sure you read and understand all preoperative and postoperative instructions before your treatment, as your vision will be blurry afterwards. And that could be like that for potentially a few days. Once you meet your surgeon at the clinic, do ask any remaining medical questions or concerns that you might have. Jot it down beforehand if there's something that you want to go over before your treatment. And next, make sure you already have arranged transportation home before undergoing the procedure. You want a stress-free transition from clinic to home. And that's it. Do remember to follow your doctor's specific instructions. At my clinic, we provide a full guide on what to do and what to expect once you're at home. The end result will be worth it, and most patients say that they wish they'd done it sooner.